Hey viewers, welcome back to my channel. So in this video I will share the care plan on electrical burn, and here the subject is child health nursing. So as usual, first you have to write the biographic data. So name Jinit K, age 10 years, sex male, religion Hindu, IP number, ward, emergency ward, date of admission, name of father, occupation means father's occupation, and name of mother and mother's occupation, developmental age. So here the developmental age is schooler. Then diagnosis electrical burn. Chief complaints. So patient father came with complaints of multiple burn due to electrical shock. So here the patient got 3 burns, and the places are fingertips, on the dorsum of left hand, and third on the chest. And also patient lost his bladder control. Present health history. Mr. Jinit K, 10 years aged, was admitted to the emergency ward on 18 June 2021 with the complaints of multiple burn due to electrical shock and loss of bladder control. The client did not experience any further trauma. There was no evident presence of consciousness or evidence of consciousness, seizure, muscle spasm, and bleeding. Now past health history. There was no significant history of past medical or surgical health history. Okay, then family tree and also family chart. Now personal history. Eliminatory pattern, sleeping pattern, and socio-economic history. Under eliminatory pattern, the client lost his bladder control. Then sleeping pattern, currently not able to sleep properly due to pain in the burnt area. And socio-economic history, the client belongs to a middle class family. He lives in a Paka house and water supply is good. Next, play history. The child likes to play with his friends. He is able to jump, run, and tends to refuse heterosexual friends. So heterosexual friends in the sense like लड़का लोग के साथ ही खेलना पसंद करता है. Okay. Next, nutritional history. The client likes both veg and non-veg food. Okay, he took 3 large meals and 2 times snacks. Large meal contains rice, dal, sabji, egg, chicken, fish, bread. Then snacks, milk and biscuit, and also suji. And here, so the client's nutritional status is good. Now moving to the birth history of the child. So antenatal history, nutritional status and health status during pregnancy was good. No significant presence of history of illness during pregnancy, and no history of infections such as TB, rubella. Then intranatal history, Mr. Jineed was born at full term by vaginal delivery without any complications, and baby was delivered at hospital. Then postnatal history. Under postnatal history, patient had cried immediately after the birth. Birth weight was 3.5 kg. No history of birth injury and no evident history of convulsions, sinuses, jaundice, fever, rash, etc. Now immunization schedule. Developmental history. First, biologic development: weight, length, head circumference, chest circumference, respiratory rate, pulse rate, BP. Motor development. Gross motor development: can run, jump, yes. Can start, turn, stop effectively in games, yes. Can make running, jump, yes. Then fine motor development: able to do schoolwork and can perform household work so perfectly without support. Sensory development: follows rule to avoid punishment, interested in why and how, see differences more than similarities, exempt of failure, and attention span increases. Then language development. Under language development, improvement in sentence structure, use of grammar and pronunciation. Then tremendous growth in use of words, speech proceed from egocentric to social. Psychological or emotional development: curious about everything, peer oriented, and begins a hero worship. Psychological development: associate with same-sex person and tends to ignore members of opposite sex, able to control anger. Physiological assessment. General assessment: body build, healthy, mental status conscious, activity reduced due to burn. Anthropometric measurement: weight 32 kg, height 130 cm, head circumference 52 cm, chest circumference 56 cm, BMI. So here the formula is weight in kg by height in meter square. So weight was 32 and 130 cm equal to 1.330 meter. So whole square, 32 divided by 1.30 whole square and equal to 18.93. So the client is well nourished. Now vital signs: temperature 98.6 degree Fahrenheit, pulse 90 beats per minute, respiration 20 breaths per minute, blood pressure 120 by 80 mmHg. Next, head and face. Hair color is brownish with adequate distribution. Scalp is free from dandruff. Face appears to be symmetrical. No evidence of facial puffiness and bruises. Eyes, vision 6 by 6, that is normal. Then eyebrows symmetrical and evenly distributed. Pupils equally retracting with light. Sclera and conjunctiva are found to be normal. No evidence of eyelid infection. Ear. Hearing is normal. Ears are found to be symmetrical in shape and size. Discharge. No evident signs of discharge or any infection. Nose. No history of deviated nasal septum. So here the nasal septum is normal. Then no evident presence of nasal discharge or any infection. Mouth and throat. Presence of dry mouth. Tongue is pinkish in color. No evident signs of dental caries. Neck. No significant signs of neck stiffness or enlargement of thyroid gland. Client is able to perform complete range of motion exercise. Chest. Heart sounds S1 and S2 hard. Thorax shape normal. Then chest expansion normal. Breath sound normal. No evident sign of any congenital or evident presence of any congenital defect. And here skin. Skin got damaged due to burn. Next, abdomen. On inspection, no evidence of any deformity on abdomen. On palpation, non-tender and relaxed muscle tone is present. On percussion, vowel sounds are normal. Then on auscultation, vowel signs are found to be normal. Back. No evident signs of birth defect. No evident presence of rash, pain and swelling. Nails. Nails are black due to shock. No significant presence of infection. Skin. Skin is perforated on the chest due to electrical burn and redness is present on the anterior chest. Genitourinary. No evident history of any congenital anomalies. The client is unable to control bladder. Small, frequent urination. Bowel movement is found to be decreased. Extremities. Under extremities, upper extremities, the dorsum of left hand got burned, unable to do range of motion exercise. Lower extremities, both legs are found to be normal, symmetrical in size and shape. Then complete range of motion is possible in both legs. Nursing diagnosis. Impaired skin integrity related to disruption of skin as evidenced by color and pain of the skin. Acute pain related to the destruction of skin as evidenced by reports of pain. Disturbed body image related to traumatic events as evidenced by facial mask of fear. Then risk for fluid volume deficit related to loss of fluid through burn wounds. Then risk for infection related to traumatized tissue and environmental exposure. Care plans. Assessment. Subjective data. Patient says that I am having pain in my fingers and chest. Objective data. Client has ruptured skin on that particular sites as well as color got changed. Then impaired skin integrity related to disruption of skin as evidenced by color and pain of the skin. Goal. Client will achieve timely healing of burned areas. Then interventions. Assess and document size, color, depth of wound, condition of surrounding skin. Rationale. To provide baseline, it provides baseline information about needs for skin. Then keep skin free from pressure. Rationale. Promotes circulation and prevents ischemia and necrosis. Then maintain desired position and immobility of area when indicated. So movement of tissue under graft can dislodge it and interfering with optimal healing. Wash site with mild soap, rinse and lubricate with cream several times daily after dressing are removed and healing is accomplished. Here the rationale is newly grafted skin sites require special care to maintain flexibility. Here the implementations of the interventions and evaluation. Client demonstrate tissue regeneration. Now the third care plan. Assessment. Subjective data is the client conveys that I am feeling pain on my burn areas. And objective data, the client has a facial mask of fear and frequently asking questions regarding burn. The nursing diagnosis. Here the nursing diagnosis is disturbed body image related to traumatic event as patient's facial mask of fear. Then goal. Incorporate changes into self-concept without negative self-esteem and client verbalize acceptance of self in situation. Then interventions. Acknowledge and accept expressions of feeling of frustration, anger, grief without and withdrawal behavior. Rational acceptance of these feelings as a normal response to what has occurred facilitates resolution. Set limits on maladaptive behavior and help patient to identify positive behavior. Rational. As patient tends to deal with crisis in the same way they have dealt with problems in the past. Encourage client to view wounds and assist with care as appropriate. Promotes acceptance of reality of injury and of change in body image of self as different. Give positive reinforcement of progress and endeavors. Here the rationale is it supports development of positive coping behavior. And again, implementations of these interventions. Then evaluation. The client incorporated changes into self-concept without negative self-esteem. Fourth care plan. On observation, there was decreased urine output, electrolyte imbalance. So, diagnosis: risk for fluid volume deficit related to loss of fluid through burn wounds. Goal: to maintain fluid balance. Now, interventions: monitor vital signs, CVP, central venous pressure, capillary refill, strength of bladder. So, rationale: these serves as a guide to fluid replacement needs. Estimate wound drainage and insensible losses. Rationale: increased capillary permeability, protein shaped inflammatory process greatly affects circulating volume and urinary output. Weight the client daily. Rationale is fluid replacement formulas partly depends on admission of weight. Then measure circumference of burned extremities as indicated. Rationale: it is helpful in estimating extent of edema and fluid shifts affecting circulating volume and urine output. Then administer calculated IV replacement of fluids, electrolytes, plasma and albumin. Rationale: fluid resuscitation replaces lost fluids and electrolytes and prevents further complication. And again, implementation of the interventions. And evaluation: the client demonstrated improved fluid balance as there was adequate urinary output and stable vital signs, and you can also write that there was no signs of any dehydration. Fifth care plan. Subjective data: patient says that I am feeling itching on the burned areas. Then objective data: erythema or redness on burned areas, skin got disrupted, environmental exposure of ruptured skin. Then nursing diagnosis: risk for infection related to traumatized tissue and environmental exposure. Then goal: the client will achieve timely wound healing free from purulent exudate and be afebrile. Then interventions. Under interventions, examine wounds daily and note changes in appearance, color, odor and quantity of drainage. Rational: indicators of sepsis requiring prompt evaluation and interventions. Then implement appropriate isolation technique as indicated to reduce risk of cross-contamination and exposure to multiple bacterial flora. Prevent skin-to-skin surface contact. Rational: provides for early detection of burned wound infection. Then administer topical agents as indicated to prevent bacterial growth and drying of wounds. Also to prevent itching. Then again, implementations of these interventions and evaluation. The client displayed timely wound healing process free of purulent exudates. Now health education: maintain personal hygiene by proper hand washing technique, regular dressing, changing and cleaning the non-dressed area. Then drink adequate water to maintain hydration. Nutrition: instruct patient to maintain a well nutritional status as nutrition plays a vital role in wound healing. Then adequate nutrition fosters wound healing process. A diet high in protein, energy, calcium and micronutrients has been shown to be most beneficial for wound healing. Then never leave the child unattended near a fireplace. Then advised family member to apply topical cream regularly as indicated. Instructed the client for follow-up care. That's all about this care plan. Thanks for watching. Please guys do subscribe my channel. If you are getting help from this video, please do help me also. Please subscribe my channel and like the videos. Thank you.